Well, hello, everyone, and welcome to another week in MHA621, where the focus is on the healthcare professionals. And so it's a fairly short YouTube lecture this week because there's some excellent material on the Blackboard site that I'd really like you to, digest. So why don't we get started here? At the end of this lecture module, hopefully you'll be able to identify the evolution of the range of healthcare professions. So it's not just breadth, but it's also depth, excuse me. And I want to start with, I know it's sort of cheesy to start with the cartoon stuff. I love the cartoons from the New Yorker. It says you can't list your iPhone as your primary care physician. Don't we all? It doesn't matter if it's just a basic search through Google or specifically through WebMD. The volume of information, and I'm going to say pretty accurate information accessible to us, to the general population, certainly has caused a shift in the need for healthcare professionals. Now, not negating at all the need for healthcare professionals, but I think every one of us, certainly healthcare professionals as well, are relying perhaps for emergency information, medication information as well, and just all that we can access. Over the last 10 years, as information has become much more readily available, it's really sort of been focused more on general type stuff as opposed to specific websites. That aside, there's certainly a need for a variety of healthcare professionals. So not sure if you're familiar with the Bureau of Labor Statistics, but check out the website because it's updated it's updated all the time, but certainly an annual update is done. And you have everything from, obviously you can see here, athletic trainers to chiropractors to lab technicians, to other kinds of healthcare professionals. They talk about the median pay, the entry level, the job summary. There's definitely, as you can tell, certainly a need for a variety of occupations. In the last 5-10 years, that need has been exacerbated not only by the aging population, which leads to a greater demand, but then that focus is not just, first of all, it doesn't cross the board in terms of all types of, I'm going to just say clinical professions as well, but it is concentrated in direct hands-on care. And certainly for older adults, that doesn't necessarily mean perhaps higher paid occupations. It does mean perhaps aides, nursing assistants, medical assistants, which typically are the lower paid healthcare professionals. That's where really the need is greatest. And then if we talk about professions like nursing, that it's actually doesn't do any good to just say nursing in general because it's so specified. I know I'm speaking to a few nurses out there as well, but where are those needs? So I invite you to take a look at the BLS. It is a nationwide view, which of course you probably realize, doesn't necessary categories where the need is in Southern Indiana versus Western New York, because they are different as well. But what I'd like to do is, I'm right on the page, focus on contemporary issues for healthcare professionals. So let me write a few things down. 3 things in particular. Independent healthcare professionals, sort of the way of the past versus groups and teams. A system-oriented view with a focus on patient-centered care, and I think most people have heard of that. And then the idea of presence, being present. It actually goes back to the iPhone example. And so historically, healthcare professionals, especially at the higher end of the food chain, let's say the highest paid physicians in particular, really were independent. Perhaps there were small groups. That's really shifted over the last 20 years into a group concept and into teams. And so the focus on teamwork, interprofessional education, interprofessional, so healthcare professionals in many instances working as a member of a team. It's a very different concept. What you do, though, is, you still have, and I think about sports teams, very talented individuals, certainly qualified individuals, but they're all part of a team concept and they all have a function. But if you have talented individuals, and again, if you think about any type of athletic team who are good at their position, they might not necessarily function well as a team. Those of you who have been part of a team or coached a team or dragged your kids to a team activity understand what I'm talking about. You certainly have superstars. And I'm not just talking about the stars, but there's a very different dynamic in healthcare when you move to a team concept, because at the center of the team, which is the patient-centeredness, is the patient. And of course, family members, perhaps. It doesn't necessarily mean that the team communicates. And so that concept is really here to stay. And so I was actually just speaking to a physician that I'm working with on a project recently about this notion. And when he was going through his initial training, medical school and residency, the idea of teams in healthcare were just coming online. And now he's a member of a number of teams. Certainly he's a primary care physician, but the team concept extends to the other clinicians, the front desk staff, a pharmacist added to the team, a case manager added to the team. It's actually a fairly large team for the practice that he's in. And it actually works very well, almost to the point that they have, they're going to have an IT, information technology individual attached, not full-time, but sort of part-time on loan to the team, just because the IT presence, and this is what we'll get to in terms of system orientation. Every team doesn't exist like this, but certainly as you look at other practices, I think about a dental practice as well, where certainly there are lots of different parts of the team, but it has to flow well. And so whether it be teams, groups, the real challenge now is how to operate well, how to function well as a team, the difference between groups and teams. And that's because we look at a system approach, looking at patient care across perhaps a lifespan, which is very much a systems approach, incorporating elements that perhaps were outside of the direct purview of, let's say, a healthcare episode. And so how do pharmacy concerns or potential long-term care concerns, if we're talking about an individual who requires long-term care or might be, how does that come into play? So a systems approach can operate vertically and horizontally. As let's say, if we think about a primary care practice, I'll use that example because I used it before, knowing that eventually individuals might need pharmacy concerns, but they also need long-term care concerns or surgical concerns, but still carrying on with the practice, maybe specialty concerns for something that develops, but over time they stay within the practice. That's very much a vertical type approach to healthcare, and still focused on the patient. And so again, having members of the team, healthcare professionals, think about the individual that they're caring for from a wide variety of perspectives. And I mentioned IT, or electronic health records. This physician I was speaking to was lamenting, I need some caffeine, sorry, lamenting the fact that that there are, because he's part of a very large system, his practices, and they have all kinds of quality indicators, quality measures. I think many of you know what I'm talking about, whether a patient has who has diabetes, has a certain blood sugar level, or, and it's all entered into the IT system, the electronic health record. And so lots of clicks on the computer. And so what occurs is, as healthcare professionals are engaging with patients, are they present? Are they present not just because they're required to perhaps type in stuff, and some practices have scribes, some of you have, to really assist with that. Those are usually specialty practices, orthopedics, I think of, or in an emergency medicine situation. How present are healthcare professionals? As a general population, you and I want our healthcare professionals to be present. That could be face-to-face. It could be through telehealth. It could be through refilling a prescription. Again, but there's just so many hours in the day and so many other factors that occupy the time of healthcare professionals, like quality indicators. Those are important. It's important to track. I think we all understand that. But there's so many hours in the day. And so let me go to some of my summary thoughts here, which are really based on the contemporary issues. The notion of teamwork, for me, this is actually one of the most interesting. Teamwork is hard because the idea of functioning as a team, for the most part, and if you think about a team, you think about perhaps an individual or a set of individuals who can manage, who can inspire, who can motivate. And that idea comes to play in a coach or coaches, and maybe there's assistant coaches. Again, I'm thinking about a sports team, but that doesn't really exist in healthcare. I mean, we ask healthcare professionals to function as a team without a coach. And you think about coaches who can gel the team together, or who can bring on individuals who are leaders. They might not be the raw leaders, but they demonstrate quiet leadership. But in healthcare, this is a challenge. We've moved to a systems orient. I can't even spell. Sorry about that. Systems approach, which makes a lot of sense, because healthcare is hopefully moving away from episodic care, one episode at a time. Okay, the person comes in for whatever issue, healthy or not healthy, we take care of what we have to, and then they move on. But the idea is, what about over time? And the over time thing really lends itself much more to a systems approach. I want to end with a focus on outcomes, data. So I think about IT, because we started with the idea of an iPhone. And of course, many of you probably have wonderful access to your electronic health record on your phone. And it's really a great thing. We can track things. Not everyone does. But if you do, it engages individuals as part of this patient-centeredness. That information has to be entered, checked, changed. And the focus is also on the system, on the IT system working. Well, that engages healthcare professionals directly, but it also could engage them all the time as well. And certainly there are no other types of professions that I am as aware of where it operates on a 24/7 basis. Not all healthcare professions, but mainly do. So it doesn't matter when you're listening to this, we know that individuals are engaged in caring for patients. So let me stop right there. See if you have any questions, comments, please let me know. Reach out to me. Again, I want to remind you, check out the really excellent content on the Blackboard site, some of the readings, and they merge well into this lecture. Okay, thank you, folks. Reach out to me if you have any questions. Otherwise, I'll see you on Blackboard soon. Bye.